Hi, my name is Dr. Michelle Cotty, and I'm a psychiatric mental health nurse practitioner. So, previously, we had talked about cognitive distortions, and we had an introduction to cognitive behavior therapy and started to look at identifying our emotions and our behaviors and our automatic thoughts. We also talked about nonviolent communication and how to use assertive communication instead of passive aggressive, or aggressive. So let's review really quick the signs of, or the three parts rather, of cognitive behavioral therapy. So if you think of a triangle, in the middle is a situation, and then on one side is an emotion, at the top is our automatic thought, and on the other end of the triangle is our behavior. Last week, we also learned about a healthy coping tool, and that was guided meditation. And if you recall, the guided meditation only needs to last a very short period of time. In order to have effective habit change, we need to make very small changes. We'll see big results over a period of time. So last week we talked about remembering a strong negative emotion. So I want you to take a minute and think of a time when you had a really strong positive emotion. Really strong positive emotion. And then write that down. So, what are some things that you like to do when you're not feeling depressed and when you're not feeling anxious? So, think about some things that you like to do when you're not feeling depressed, you're not stressed out, and you're not feeling anxious. What brings you joy? So, dancing brings me joy, for example, and outdoor activities. So those are things that I like to do when I'm not feeling depressed, anxious, or stressed out. All right, so write those things down, set them aside, and we'll come back to them. So our key points today: emotions come in ranges. Are the emotions that you feel proportionate to the situation? You should expect to feel things. Feeling is not a bad thing. So negative emotions are a normal part of life. When we pay attention to the mental movie or automatic thought in our head, we've taken the first step to identifying our automatic thoughts. Now we want to start to identify our negative thinking and replace it with positive thinking. So think about maybe last week or earlier today when you had a situation, and after that situation occurred or while it was occurring, you had a negative automatic thought. Now, let's rethink that scenario and reframe it into a positive thought. So I'll give you an example. I was supposed to have plans tonight with a friend, and I hadn't heard from the friend and got a text message that the friend was going to have to cancel. And I could have had the automatic thought that I was very frustrated that this person isn't reliable, that they always cancel, or maybe that they didn't want to hang out with me. But instead, I just read the text message. I didn't react. So the next thing that happened was that friend texted me that they'd had a kidney stone. So if I would have had the automatic negative thought that this person doesn't want to hang out with me, I could have reframed that into a more positive thought that I'm sure this person wants to hang out with me. Something must have come up. And something did come up, which is why we have to be careful about what we think. So when we identify automatic thoughts, we can replace our negative thinking with the positive thinking. So when we think about range of emotions, we want to think about how happy or how sad or how angry we are during certain situations and think about, is that an appropriate emotion? If we remember last week, our example was dirty dishes in the sink. If I come home and I see dirty dishes in the sink and I start screaming, is that an appropriate emotion for that situation? Probably not. So we want to think about, are our emotions appropriate for situations? So one thing that we can do when situations arise is to use something called Socratic questioning. And Socratic questioning is a way that we can kind of be our own therapist and analyze what we're thinking. So I'm going to pull this up here. So if a situation arrives, like a friend canceling, you can ask yourself a series of questions. What is the evidence that your thought is true? What's my evidence that that person doesn't like me? Is there any evidence on the other side? Is there another way to look at the situation? And what if it was true? How would I cope with that? Somebody not liking you or being critical of you or not inviting you is one outcome, and it could be the worst outcome. But what is the best possible outcome? And what's the most realistic? So if a situation arises, what's the evidence that this is true? What's the evidence that it's not true? What's another way we can look at it? If the worst possible outcome is true, how do we cope with that? What is the best possible outcome? And what is the most realistic outcome? What is the effect of telling yourself the negative cognitive distortion? And what can be the impact of changing your thinking? So if a friend would come to you and tell you a situation, we'll use the friend canceling. So they come to you and they say, my friend canceled on me, nobody likes me, nobody invites me to anything. You could ask them, what's the evidence that that's true, that nobody likes you? Well, they, canceled on me again, and nobody ever wants to hang out with me, and last week Sally canceled on me. Is there any evidence on the other side that maybe people do like you? Well, I suppose that there is evidence. I mean, Sally and I have hung out 5 other times this month, but she did just cancel on me this week. So she must not like me. Is there another way that we could look at the situation? Maybe Sally's overwhelmed. Maybe something came up. And if Sally doesn't want to hang out with you, how are you going to cope with that? Her not wanting to hang out with you is the worst outcome, but what's the best possible outcome? Well, I guess the best possible outcome is that she reschedules and we hang out later this week. Okay. So what is the most realistic outcome? Well, realistically, we'll probably hang out sometime later this month. She's been pretty busy. So what's the effect of telling yourself that Sally does not want to hang out with you? Or that your boss is angry? Or that nobody loves you or appreciates you? And what is the effect of changing your thinking? When we tell ourselves these negative stories, we change our behaviors and we have emotions attached to that thought. And if we tell ourselves a different story, we experience more positive emotions, less depression, less anxiety, and we react in a more positive way. So when you are trying to challenge your own thoughts, think about what would you tell your friend in this situation and how does that apply to you? Finally, ask yourself, what do I do now? Well, I guess I'll tell Sally I really missed her tonight and I can't wait to see her again. So that is one way that we can use Socratic questioning to challenge our own thinking. This week, our coping tool is progressive muscle relaxation. And again, there's a link for YouTube. And we want to start releasing negative statements and replace them with positive ones. Okay. So when you identify a cognitive distortion, remember this week, situations are going to arise. You're going to have an automatic thought that's going to have a feeling and a behavior. And we're going to say, I see what's happening there, thought. I have a cognitive distortion. I'm mind reading. I'm fortune telling. I have black or white thinking. What else could be going on? Now I'm going to use that step, Socratic questioning, and I'm going to replace that cognitive distortion with a positive statement. So if I get home and the dishes aren't done, and I think that nobody loves me because they don't do the dishes, I'm going to replace that with, I'm sure they love me, and obviously they appreciated dinner because they ate it, and I'm so grateful they put their dishes in the sink. And I bet they're busy too and just forgot to put them in the dishwasher. Maybe they were running late. When we identify the cognitive distortion and we use Socratic questioning, we can start to change the way that we think, which will change the way we feel and the way that we behave. This can help us reduce depression and anxiety, which is the goal, at least one of the goals, of cognitive behavioral therapy. Please check out the worksheets also on the website that go along with this little video. Have a great week. And again, remember to attach this week's coping tool to something that you already do. So progressive muscle relaxation, I like to do at night. Maybe when you plug your phone in at night before you go to sleep, you play the YouTube video for 3 minutes and try something new. Have a great week.